Mid-career family medicine renegotiation. The leverage points your employer already knows. The 2025 National Family Medicine data shows that newly hired guaranteed compensation for family medicine without obstetrics is $240,000 at the national median. Incumbent physician compensation is $311,557. The gap between those two numbers, $71,557, is what a family medicine physician earns their way across over their first several years of practice. If you have been employed for 3 or more years and you have never initiated a formal renegotiation, there is a meaningful probability that gap has not fully closed. 4 leverage points specific to family medicine mid-career renegotiation. First, the panel continuity argument. A family medicine physician who has practiced at the same location for 3 or more years has done something that cannot be recruited into existence: built longitudinal patient relationships that represent substantial practice value. Attributed panels with high continuity rates, meaning patients who consistently see the same physician, generate better preventive care metrics, lower emergency department utilization, and higher chronic disease management scores. These are measurable outcomes. If your practice has data showing your panel's continuity metrics are above the group average, those numbers belong in your renegotiation conversation. You are not asking for a raise. You are presenting the return on the investment the practice made in keeping you. Second, the collections to compensation gap. Median family medicine collections per physician are $509,768. Median total compensation is $311,557. The practice retains $198,211 per physician above comp at the national median. If your personal collections are above the median, which is verifiable through your billing reports, your collections to compensation ratio is a direct argument for compensation adjustment. A physician generating $580,000 in collections and being paid $295,000 has a comp to collections ratio of 50.9%, well below the national median ratio of 61.9%. That is not a preference, it is a documented data point. Third, the scope expansion argument. Mid-career family medicine physicians frequently take on roles that were not priced into the original contract: supervising advanced practice providers, running quality improvement initiatives, serving as a clinical preceptor for medical students or residents, or functioning as a point of contact for new physician onboarding. The 2025 National Family Medicine data shows median administrative allocation at 0% of total compensation, meaning these contributions are typically uncompensated at the contract level. Naming them specifically in a renegotiation, with an estimate of time spent and a request for either an administrative stipend or protected clinical time reduction, converts a voluntary contribution into a negotiating asset. Fourth, the obstetrics carve-out conversation. For family medicine physicians who carry an obstetrics panel, the compensation structure question at mid-career is whether the obstetrics component of your work is compensated on the same dollar per work RVU rate as your outpatient panel. The 2025 National Family Medicine data shows that family medicine with obstetrics physicians actually earn less at median, $287,555 versus $311,557, despite generating more work RVUs through deliveries. That compression is the leverage point for a mid-career physician who is doing obstetrics work at a compensation rate that does not reflect the additional clinical risk, call burden, and malpractice exposure. Renegotiation in family medicine is a data presentation, not a salary request. Arrive with specific numbers, collections data, panel continuity metrics, scope documentation, and benchmark comparisons. The physician with specific data moves the conversation. The physician with a number alone does not. Run your contract through ClauseLine at clauseline.com.